Disaster Plan, HICS, HICS, Healthcare Incident Command System. This plan is to be used in the event of a catastrophe which may result in a large number of casualties. It is planned that, as far as possible, the emergency duties of employees will be similar to their normal responsibilities. However, it may be necessary to assign additional duties in order to meet the requirements of the disaster, and in some cases, employees may be required to function in other fields other than those regularly assigned. HICS was established when 9/11 happened, and the main command center was in one of the towers, and we were not able to utilize our command system. Because of that, the government decided that everybody should be prepared for an evacuation or a catastrophe that may have a large number of casualties. So this plan calls for 3 possible main courses of action. Expansion. It may be necessary to provide facilities for outside casualties in large public areas such as the recreation area or dining rooms, meaning that if another facility needs to evacuate, they can come to another facility, such as our facility. Surge planning for any internal and external events that require shelter in place, which is SIP, meaning that if the air outside is not safe, we would have to stay inside, so that would be mandated to shelter in place. And evacuation, the removal of some or all of the residents from the threatened or affected areas should the disaster occur within the home, within the facility. It is important to remember that all the following procedures can be used for either evacuation or expansion in case of a disaster. The plan designates alternate areas depending upon the location of the disaster. There are 4 levels. Level 1, activation, no command center is open. Activated for an incident that has the potential for producing casualties for whom advance notice has been received, but no impact is noted in the facility, such as monitoring a hurricane or a snowstorm, concurrent with initial notification of a fire in the facility. The emergency management plan shall automatically be activated at level 1. Once again, the command center is not open. We're basically just monitoring. Level 2, possible command center opening. Activated for an incident with a minor impact on facility operations. We're still monitoring it, but it might be minor impact, but greater possibility. Level 3, open command center. That means that the command center is definitely open. It's activated for an incident with a moderate impact on facility operations. So the command center is fully open and expect moderate impact on facility, such as having to be mandated to stay here for safety, checking to make sure that we have enough supplies, food and water. And then level 4 activation, open command center, alternate site command center. This is activated for an incident with significant amount on an impact on the facility operations, including the potential for a long duration. So it's possibly an evacuation. To activate this plan, we notify the nursing supervisors, we describe the location, the situation, and specific assistance needed. The operator will announce code, HICS level, and whatever level that is. Our command center is in the Woodcrest conference room. However, when we're off when weekends and 3 to 11, 11 to 7, it may be in the nursing supervisor's office.